20 years, Kobe Medical Center. This also uses barcode technology to the hilt. Very quickly, because I find a lot of students here, I'm not going to explain what barcode technology is there, but the definition of barcodes is there in my presentation, which might be useful, and you can pick it up from the organizers. And when you're talking about the hardware that is required, very quickly you require fairly a good computer system, a barcode printer, a plastic card printer, a barcode scanner, barcode enabling software, a barcode, you can use barcodes in the wristbands or the plastic cards for patient identification. Of course, when you're talking about barcode scanners, very interesting, I have found you have portable scanners, you have scanners which are connected, which have a variety of application, and again you can use it the way you want it depending upon your application. Very quickly, there are also standards given by the Uniform Code Council in US for the barcodes, and we need to follow them, and those details also you can see it later. But when you're talking about barcodes at the point of care, you are able to improve the safety, you are able to improve the quality of care, and you're able to get the right patient, the right treatment, and the right time. This is a very classical example. This is a hospital which gets about 500 outpatients a day, and all these outpatients are given reusable plastic cards, and these cards are printed like this and given to them. And just imagine at the peak hour, when you are talking about, say, 500 patients in the peak hour, you get about 300 to 400 patients in the lobby, and it is very difficult to key in the names. They just scan, and they are able to get the entire detail, and they are directed, if they are new patients, the registration fee is collected, otherwise they are directed to the relevant departments with the medical records. And this is the barcode printer and the plastic card printer. Previously, when we had an embossing machine, broadband embossing machine, we had great difficulties, but today the technology has become very, very simple. This is another hospital in Madurai, Meenakshi Mission Hospital. They get about almost 600, 700 patients every day, and this was the kind of problem they had before the barcodes were implemented. Once the barcodes are, you see a lady giving the barcode, and the crowd simply melted away in a matter of about 2 weeks. So what all they do is they just take the card and then do a scanning, and they're able to get all the details. This is one very simple application. And then this is, of course, I understand many hospitals use it, but we have found this wristband technology as very, very useful. And this reduces medical errors, and these are the different kinds of wristbands which are being used. I find only in large hospitals these wristbands are used with the barcodes. These wristbands with barcodes are very either for giving medication or for food or for giving blood, we find that the error is practically nil when we use this kind of wristbands, and the NABH insists on these kinds of wristbands. You see the way these wristbands are being used with the barcodes. And barcodes, of course, in the laboratories are extremely useful. And people like us have been using these barcodes for the last 5-6 years with the network of all laboratory equipments. And as the requisitions are made by the nurse in the ward station, we have about 25 ward stations, and if we make about 1,500 requests, with the 1,500 requests, 1,500 barcodes are printed, and barcodes get generated, and these barcodes are stuck to the test tubes, and they go to the laboratory. And this is how the barcodes are stuck, and then it is being used, and so useful, and the error rates are practically, we reach the 6 sigma level. Of course, this is some theory about it, and I told you, I don't know if you're able to read the numbers, almost about 3,088 barcodes are printed in different departments and different sections like bacteriology, biochemistry, and all that. Date-wise, I have given you the details. Previously, they used to write down these details. Now, the barcodes provide all that kind of facility. This is another important facility provided with the barcodes. Nowadays, we use a pneumatic pipeline system, but when we use the pneumatic pipeline system for dispatching the samples of medicines, but we don't know who has sent. If there is a problem of the missed carrier in some ward, we are not able to find out who has sent it. And so today we give barcodes even for the employees, and these barcodes are shown in the barcode scanner available in the PTS station, and we are able to track. So you see each of these employees have a badge, and these badges have a barcode. So this is in the stores department, and that is in the laboratory, and other is in the ward station. And when I went to Tokyo, I found this is a university hospital in Tokyo. What is very interesting and is simply amazing is that there are no cash transactions. They don't seem to use any paper, and everything is on wheels, and everything is on scanning, everything is on barcodes. And you see everywhere you have kiosks which read the barcodes, and it is so interesting. If they can do it, why we should not do it? Of course, even capturing the attendant details of the consultants, we used to do it using the barcodes because they were also considered as employees. They didn't want to go and give biometric attendance. This is an e-cash facility. Each e-cash facility, the e-purse facility is an extraordinary facility with a barcode card. Like you do the Petro card, we just ask the patients to deposit some money, and this money is kept in the electronic passbook. And these patients go around the hospital, whether it is maybe cardiology or radiology or consultation or physiotherapy or pharmacy or canteen or even parking. They just go and they swipe, and the whole thing gets deducted. You see, this is a practical situation where 1,775 is deducted. And I thought, 5 years ago, I introduced it in Kobe Medical Center, but you see here, so beautifully done in All India Institute of Medical Sciences, and I really appreciate the administrator there, one which is there. She has done it here. You see, this is the center in which they have done. And you see the crowd, huge crowd in that neuro department. And this is the kind of barcoded card they give. They just load it, and I understand that about 200 to 300 cards are being issued every day. Just imagine with a patient load of about 5,000, if they can start using this in a place like All India Institute, it would be great, really. This is the kind of card they give, and even for 10 rupees ECG, they can just don't have to wait in the cash counter, and they can keep on deducting it from this barcoded card. As they go to the service area, they swipe, and then they get a slip like this, and so they know what is the kind of facility they have utilized and what is the money that has been debited. What is very interesting is they have educated the patients about the barcode. They have just given a small write-up in English and also in Hindi, and there are also counselors who tell them how to use those cards. In fact, this is a very interesting case which I implemented when I was in Kobe Medical Center. We had problem of delivering the patients or transporting the patients inside the hospital. So suppose we have about, say, 400 transports inside the hospital in a 500-bed hospital. We didn't know when the call came and whether the patients were transported properly. So barcodes were given, and they have to simply swipe. And once we swipe, we know when the patient was taken away from the room and then delivered. There again, they just have to swipe, and you see even wheelchair and stretcher trolleys are all ordered through phone. And we are able to find out through the software when they have been installed and given. And of course, even the medical records also, we used to give the codes to the employees, and these employees take the medical records and hand it over. All the medical records are barcoded, and I can find out each of the employee how many medical records he has transported. We will be able to see, and how many trips they have made. All that is possible using these barcode strips. Of course, even the central sterilization department, we use barcodes here, and even for asset tracking, for all the assets, for tracking or maybe even for billing purposes, we use this barcode system there. In one thing I want to tell you that barcode system is not very effective in pharmacy because the manufacturers do not use barcodes, so we are not able to use the barcodes in the pharmacy. But even in the dietary, the diet orders are given. The diet orders get generated with a barcode, and even cup of coffee or tea or any diet goes with a barcode. So even vehicle parking, we can use the barcode cards. Previously we were doing like this, then barcode cards are used to be used for swiping, and that's how it is being done. So thank you very much, and I think I took a little more time, but still I came all the way from Trichy. Thank you very much.
Thank you everyone for being with us. We had a bit of malfunction in some video elements that we wanted to show. Took a little bit of time, but I guess we have come to the end of the program. Given the fact that we are a little out of time, I would suggest that we have a networking point. Maybe you could pick up those questions at that point of time. So we're really not having a Q&A at this point. But I am obligated to answer Ananda Padmanabhan on his question, that he gave me 3 options in terms of why he was the last speaker. I told him that there's a 4th option, which is none of the above, which I would tell him in private. Okay. Before we conclude for the evening, I think there is a very important announcement. I request Dr. Ganapathy to come on stage and.
Thank you. First of all, it's absolutely thrilling for me to see so many people listening with rapt attention at 6:35, having started at 9 o'clock in the morning. I think this is a tremendous compliment to the attendees, and thank you once again for making it so lively for all the speakers. Now, just give me 600 seconds more. Can I please call Mrs. Sangeeta to the stage? It was draft the Cyberbad resolution. And I think this could be a very historic moment today. Let's be optimistic. Let's hope something happens. We have just drafted this, and I cannot think of a better, more intelligent audience than the one here. I'll just read through this. Mrs. Sangeeta, can you please come? And I'm just reading every one of you. Please feel free to change the words. Tell us what else is to be done. And